when we look at the catalog, we have a shank and we have the triangle. It's divided into two parts. The shank, as you can see here, is meant to tell you mesiodistally the space. If you hold it vertically also, the space in a vertical dimension, or the space mesiodistally. And then the triangle will help you to do a wax up, and it will help you to know these dimensions here are 7, 14, 21, and 28. Look at these numbers as what is the dimensions for people to remember. The first tip, as you can see, is 1.5 millimeter, this small tip. From here till here, all this shank is 3 millimeter in width. Then from here till here is 4 millimeter in width. And the last two parts are 5 millimeter in width, in thickness. Now, these dimensions are always necessary in implant dentistry. So when you have something 4 millimeter, it's easier for you to ask the patient to bite or keep it next to the area that you want, versus you take a ruler or a caliper. And now let us focus at the tip. At the tip, this tip here is 7 millimeter. So why is it 7? Because if you place it in a mesiodistal space, for example, you have a canine, and the 7 millimeter can go inside, then you can easily take your first drill, and it helps you to drill exactly this line is where the cingulum, the neighboring cingulums are. You have to push it buccally and palatally till you reach the cingulum. So you place your first drill more palatal because of this hole. Now, if you have 2 teeth missing, you can hold it sideways, and then same thing. You can make one hole and second hole. Now, these two holes, there is 7 millimeter distance between them. What does that mean? If you place a 4 millimeter implant or anything less than 4, there will be enough room between the two implants when you're done. When I say enough, I mean 3 millimeter, which is 3 millimeter. So if you place 2 millimeters using this side, which is 14 millimeter, if you place that, then automatically there is a 3 millimeter inter-implant distance. Now you go to 3 teeth are missing. So you use the side one. According to this, you have a side slot which should match the functional cusp, all right? Or in the lower, in the central groove, and you have the holes or the grooves inside, which is meant for you to cut. You have to match this small slot with the drill and go through it. And according to these small slots, once it matches the functional cusp on the maxilla and the central groove on the mandible, then your implant is placed slightly palatal. And that's how you drill accordingly. These are the dimensions. We mentioned 7, 14, 21, and 28. We spoke about the flexibility of the tip of this area, and this is very useful. The flexibility is very useful to be adapted to different designs of the patient's jaw. Then you have, for surgery, half a circle cut and a full circle cut. We are not promoting this. We are mainly promoting half a circle cut to bring the palatal tissue to the buccal if you want to do flapless. And for uncovery, we have this edge, which makes the cut exactly the way you want, the area that you want to place, to bring the keratinized thick tissue to the buccal area and the rest to the palatal area during uncovery.